Hello everybody. Today I wanted to weigh in on the great mask debate. Hopefully you find this video to be helpful in making your decision on whether to wear one of these or not. First I want to start off with Ipac Canada, which is actually a non-profit organization, but it also is a consultant of the Public Health Agency of Canada, the Canadian Standards Association, the Canadian Hospital Association, Operating Room Association, and the Central Supply Services and Ambulance Services for Canada. So they are somebody who are in the know on this. They're not just some conspiracy website. I'll leave the links below on everything I discuss here so that you can see it and make your decision for yourself. And I quote from the Ipac Canada site, "There is no evidence to suggest that wearing masks will prevent the spread of influenza transmission in the general population. Improper use of masks may in fact increase the risk of infection. Masks don't act as an effective barrier against disease when they are worn for extended periods of time. In addition, removing your mask incorrectly can spread virus to your hands and face." Now let's get into the over hand sanitization that's going on along with these masks, which creates superbugs. And researchers, this is actually a study that's done, I'll put the link below as well. Researchers tested a total of 139 samples of Enterococcus faecium taken from patients before and after the widespread adoption of alcohol-based hand sanitizer in Australian hospitals, covering a period from 1997 to 2015. After these samples were exposed to a disinfecting alcohol solution, it was found that the bacteria collected after 2010 were some 10 times more tolerant to the substance. So that is creating superbugs, and mask and overhand sanitization and over disinfecting of areas is what creates these things. So if you're really concerned about immune compromised people, then perhaps you should factor that into the equation. We don't want to be creating superbugs that are resistant to antibiotics and the immune system that could potentially be fatal for these people. Face masks and bacteria. Face masks essentially create bacteria. They are everything that a bacteria needs is right over your mouth. For bacteria to grow, they need a warm, moist environment with an acidic pH. And your breath is actually, for the most part, an acidic pH. So this creates the conditions for bacteria to just flourish. And think about it, you have that on your mouth all day long. So what is that doing? What is that doing for your own health? Especially when people are touching their masks and fiddling around with them on their face. Your hands are covered with the most bacteria out of pretty much anything in your body. Well, at least the bad bacteria. Because for the simple fact that you're touching everything that you come in contact with. So guaranteed, the most bacteria is probably present on your hands. You're touching it all over your face, so what do you expect to happen? You will be more prone to infection, and that's a fact. This is also a clustered of randomized trial of cloth masks compared with medical masks and healthcare workers. And I quote from these randomized trials. Penetration of cloth masks by particles was almost 97% in these trials, and medical masks it was 44%. So medical masks worked a little bit better, but really when it comes to preventing it, like it's been touted in the media for these masks, both of them don't really have a greater significance on blocking these particles at all. And I go on, moisture retention, reuse of cloth masks, and poor filtration may result in an increased risk of infection. So it's actually going to make things worse for us, and that is one of the problems with these masks. It's not only not doing anything, but it's also making things worse for us. So we should probably look into something better, which is what a lot of us been saying since the beginning of all this. We should have protected the vulnerable. We should not have masked our population. It is completely ridiculous, the fact that our elected officials are telling us to do this. But unfortunately, it's more prevalent in recent years that science is bought and paid for in this country and in other countries around the world. These health officials do not have our best interest in mind. So that is why it's very important for people to conduct their own research into these things, look into studies that have been done, preferably before 2019 or 2020, because the science was really rigged after that to fit their agenda here. But the science actually wasn't, at least not as much back before then. So if you're going to be looking at randomized trials and things like that of whether these things work or not, you want to go back a few years just to make sure that you're actually getting a little bit better information than you are these days, because things are becoming heavily censored. And I think most of all, what people need to think about when they discuss this mask protocol is you have to think about why these elected officials keep getting busted for not wearing masks. They're constantly being photographed with not wearing masks. Have you ever seen Bill Gates with a mask on? No, you have not. These people do not, they know it's a farce, right? They're telling you with their actions, and that's why you have to you have to watch their actions instead of listening to their words, basically. And you have to understand that if they knew about a virus that would be stopped by these masks, or even prevented infections of people, then they would be wearing them all the time, and they're not. They're clearly not. So you got to ask yourself why. And like I said, look into things for yourself. These are only a few key points that I thought people should really keep in mind. But yes, there's so many. If I took all the information, I'd be here all night. And I'm trying to keep this rather short so people will be more apt to pay attention to it. So, like I said, look into things yourself and find out the truth, because we're definitely not getting it from our mainstream media, which leads me to my next point. Shut off your TVs. It's one of the best things you could be doing for yourself. Anyways, take care, everybody. Love you all.